Hello, my name is Dimitri,
I'm Brittany.
And I'm Russ.
and today we're going to be talking about oral health decline within the geriatric population. So, the purpose of our table clinic is to inform our audience about the complications that can contribute to the failing oral care amongst the elderly population. We will focus on the complications of poor manual dexterity, and will offer effective solutions to remedy or improve the situation, and subsequently improve quality of life. Our intent is to provide information and focus that will benefit family members, caretakers, and providers in their personalized care for this group.
By definition, the elderly population in the United States consists of individuals aged 65 and older. In recent years, the elderly population has seen an increase in numbers. Many of this population are retaining their teeth later in life, and with it, a continuing need for proper oral hygiene and care. As an at-risk population, it is important to identify and understand the complications that can plague the elderly, as well as provide solutions that will help to improve their quality of life. This table clinic will focus on poor manual dexterity as it relates to poor oral health.
Manual dexterity is complex and can be defined as the ability to control finger movements accurately and rapidly in a coordinated and adaptive manner, such as fine control and grasping and manipulation of small objects. The 11 muscle groups of the hands are the most used muscle group of the upper extremities. These muscles are used to complete everyday tasks such as brushing, flossing, and cooking. As we age, poor manual dexterity can negatively impact activities of daily living and independence. It can affect how effectively one can keep their teeth clean and can even impact the foods chosen to eat.
The relationship between increased age and reduced hand dexterity has been widely reported in both clinical and scientific literature. Research supports that there is a decrease in hand grip strength by as much as 20 to 25% after the age of 65. A contributory factor to the decrease in dexterity is sarcopenia of old age. Older individuals with sarcopenia may experience a reduction in muscle mass in a range of 20 to 45%. With this reduction of muscle mass, one's nutrition may also be at risk. The inability to open packaging, hold utensils, and or prepare foods can lead to malnutrition. Malnutrition thus leads to the declination of muscle mass. Studies have shown an association between cognitive impairment and diminishing hand function. Disease of the nervous system, such as Parkinson's disease, arthritis, and osteoporosis are also diseases that can negatively affect hand dexterity.
So, what can we see clinically in the mouth as a result of poor manual dexterity? So, first we'd see the increase of plaque retention. The inability to brush adequately could result in areas that would allow plaque to adhere more easily to the teeth and increasing the risk for developing caries. With there being more calculus present in the mouth, we would also see increased risk of periodontal disease, which we would see as decreased bone levels. And with difficulty flossing, we would also see subgingival bacterial flora increase, which would cause inflammation of the gums, commonly known as gingivitis. So that same bacterial flora wouldn't solely remain subgingivally, it could also spread to all areas of the mouth, including the tongue. The bacterial infection would coat the tongue and cause bad breath or halitosis. This infection could progress to dysgeusia or impaired sense of taste due to the bacterial infection in the mouth.
It is important for the communities surrounding the elderly population to understand the oral health challenges they may face. While the loss of manual dexterity can provide a significant challenge to the elderly, there are many beneficial solutions that address these difficulties, improving independence and quality of life.
There is a biological truism of use it or lose it with respect to the musculoskeletal system. The changes in function of aging hands can possibly be slowed by introducing suitable, simple, and regular hand exercise programs. Daily non-strenuous activities such as ball squeezes, fist and release, as well as rubber band exercises, work to increase hand strength, grip strength, and range of motion.
So, a study conducted by dentalhealth.org found that electric toothbrushes can result in 22% less gum recession and 18% less tooth decay than a manual toothbrush. It is a fantastic tool for someone with dexterity problems because it is designed to be held in place while the bristles turn and rotate to remove the plaque. Electric toothbrushes with a built-in timer can prove useful to ensure adequate time spent brushing. If one is not in position to secure an electric toothbrush, a modified manual toothbrush can also work. Store-bought grip aids or homemade aids like tennis balls can be placed on the handle of the brush and provide an easier grip. If these solutions are not possible, then assisted brushing may be indicated. In conjunction with brushing and flossing, there's also an option of using a water flosser. A water flosser provides a big handle for easier grasp, and it would allow easier maneuverability around the mouth while providing irrigation to areas that would be harder to reach. As well as having regular dental appointments would ensure that you are completing adequate home care and to give a dentist a chance to examine your oral health and make sure there is no manifestation of diseases. Lastly, increasing the fluoride. Fluoride helps protect your teeth by strengthening the outer enamel, and if you receive too little fluoride, this would weaken your teeth and develop caries.
Aging is a fact of life that we all are going to have to deal with. It brings with it many challenges to independence and the ability to maintain oral health. Knowing how poor manual dexterity can be detrimental to our oral health is a good first step towards overcoming its challenges. Being educated on the various exercises and solutions designed to overcome the negative effects associated with poor manual dexterity will add to the ability to maintain good home care and will improve overall oral health, independence, and the quality of life in our growing elderly population.
Thank you for listening to our presentation with oral health decline in geriatric population.
We hope you enjoyed.
Me too.
And I'll just edit out this.